Leukemia is a type of cancer that affects the blood and bone marrow. One type is Philadelphia chromosome positive chronic myeloid leukemia. Some patients with CML may have difficulty finding a treatment that's right for them. Here to share her own experience being diagnosed is teacher and CML patient Jen, and here to talk about treating adults with CML is Dr. James Dugan. Good morning to you both.
Good morning.
Good morning to you. Thank you.
Yeah, now doctor, can you explain what this type of leukemia is?
Yeah, let me give you a little background. So chronic myeloid leukemia is a type of blood cancer. More specifically, it's a disease of the white blood cells, part of your immune system. These white blood cells have a very specific mutation inside of them called the Philadelphia chromosome. And because of this mutation, it makes the disease susceptible to a group of medications called the tyrosine kinase inhibitors, or TKIs for short. And really that's what we're here to discuss today is through our partnership with Novartis, we're hoping to increase people's awareness and education about CML and its various treatments.
Dr. Dugan, tell us about the treatment options for these patients as well.
Yeah, so a majority of patients will not reach their milestones and need to come off and go on to another medication, or 14% of patients will have to stop their medication because of side effects. So it's important for patients to have options that are both efficacious and tolerable. One of those options is Scemblix, or asciminib. It's approved for both newly diagnosed and previously treated patients with Ph-positive Philadelphia chromosome CML in chronic phase. These patients have a chronic disease. CML does not go away. They'll have to live with it for the rest of their natural lives. So medications need to be tolerable. All of these TKIs come with side effects. Some of the more common side effects for this particular medication are low blood counts, stomach upset, high blood pressure, rash. This is not an exhaustive list, but certainly the more common ones that I see in my clinic. And so it's important for patients to be able to discuss with their physician about the side effects that they're having and the potential of switching to an alternative TKI if they're no longer tolerating it. They can get more information at learncml.com to get a more exhaustive list of treatment options and their side effects.
Well, thank you for that. Now, Jen, can you tell us a bit about your journey with CML?
Absolutely. I was diagnosed with CML in 2014. For the first 8.5 years, I tried 3 different treatments and did not have a quality of life. The idea of living like that the rest of my life was very daunting, very humbling. I had to quit my job. My family had to take care of me. I mean, I was a true patient of cancer in every respect. But then a few years ago, I found out about Scemblix, and I started Scemblix, and my whole life turned around. I'm able to work again. I'm able to take care of my family. I still have my good and my bad days, but it's mostly good now, and I can enjoy life again, and it's just been wonderful.
Jen, thank you for sharing your journey. Given that story, I mean, what advice would you give to other adults diagnosed with this condition?
You need to advocate for yourself. Like you know your body better than anyone else. Advocate and find a doctor who will make decisions with you instead of for you.
Yeah, doctor, what should adult patients with CML know before we go?
Yeah, let me just echo what Jen just said. So at my practice at Novant Health, we're always looking to get patients on the best medicine or the most innovative clinical trials. But more important than that is the relationship that needs to be established with the patient, between the patient and physician. They are going to incur side effects, and without listening, you may be missing a treatment that will be efficacious but also tolerable. We can do both things in CML, so we need to focus on quality of life as well.
Well, Dr. Dugan, thank you so much for sharing your insight. And Jen, thank you for sharing your story with us.
Thank you.
Well, I appreciate being here. Thank you very much.
You can find out more about these new treatment options. Just head to learncml.com.